Hey friends, we're here for a short time, not a long time. Are you considering hiring a doula for your birth? If you're on the fence about whether or not you want to hire a doula, I'm going to give you 3 cons about doulas that no one talks about. Now stick around for point number 3. It's not something that a lot of people think of or talk about, but I want to make sure that you recognize it when you see it so that the same mistakes doesn't happen with you. Stay tuned and see if I recommend a doula as a labor and delivery nurse. So the first issue that you may have with your birth doula is they may lack boundaries. They may conflict with your medical staff, and that's not something you really want to have to deal with. I've definitely seen situations where the doctor is recommending X, Y, and Z, and the doula is giving so much pushback, and it's almost as if they're speaking on behalf of the patient, which would be you in this case, right? And it can create an uncomfortable situation because you may want to hear and explore what the doctor has to say. After all, they are the doctor, but your doula is adamant about what they want for you to experience. So you definitely just want to, suss out the doula's personality, how they interact with other people, how collaborative they are, to make sure that they don't interfere or hinder your progression in labor just because of the experience that they want you to have. Not that you want to have, but what they want you to have. So reason number 2, doulas are not medically trained. They are professional support people who have an idea of what happens in the labor and delivery room because they're there, and they are skilled in making sure that you are mentally, emotionally, and physically comfortable, but they are not clinically trained. It is super rare that you have a doula that's clinically trained unless you have someone who is a labor and delivery nurse turned doula, which is not super uncommon. And I actually referred a client to my friend who was a former labor and delivery nurse, and now she's a doula. I mean, how awesome would that be to have someone who can support you emotionally, physically, but also has a clinical picture and understanding of what's happening. So the reason that this can be a conflict if your doula is not medically trained, which is most commonly the case, is because your doula may try to overstep, again, that boundary and give you medical advice or advice for or against something when they don't have the clinical background to do that. And oftentimes, this is the most common issue that we run into with doulas. They just tend to overstep, or the patient has such a dependency on the doula that when their clinical provider, their medical provider, or their nurse recommends something or ask a question, they turn to their doula before even answering. And so that can be kind of awkward, but it also can create a divide between your medical team as well as your doula. Your nurse and your doctor are clinicians. They have the training and the knowledge to deal with postpartum hemorrhages or respiratory distress in a newborn or terminal decelerations in the fetal heart rate. Your medical team is skilled to do that. Your doula is not. So make sure that you understand that, and then make sure that your doula understands that so that they don't have the expectation that they are going to be interceding on your behalf. So the third point is super common, and I want to share this with you, but I see a lot of doulas step in and kind of displace the partners in the situation. And you may be okay with that. It just really depends on the dynamics of you and your family. However, if your husband or your partner wants to be super involved in the birth and have that experience with you, then you want to make sure that when you meet your doula, you guys talk about how to incorporate the whole family unit into the practices to keep you comfortable. Again, what I proactively do is let my doula know that I very much want my partner to be involved and be a part of the process. And then I would make sure that we practice different movements and techniques and include my partner so that they can do them with me. And that way, the doula, when she's tired or he's tired, can alternate out with your partner. So not one person is committed to doing it the entire time. Everyone gets a turn, everyone gets to be involved, and everyone gets a break. So let me know what you thought about these 3 points. If it's something that you've heard about or ever considered, like, comment, share, and follow, subscribe, and let me know what you think down in the comments. Bye. So would I, a labor and delivery nurse, recommend a birth doula? Absolutely, 110%. The studies are clear. The evidence supports having a birth doula and having better outcomes with them. So absolutely get your birth doula. Make sure you set some boundaries. Make sure you have a great discussion. Make sure you mesh. And happy birthing.